In our modern world, childhood obesity is a serious public health issue, greatly affecting children's physical and mental health and their social relationships. What does this currently mean for the child and for the society that surrounds him, and how can we best resolve it?
My name is Mojca Gabrielčić. I'm coming from the National Institute of Public Health, Slovenia. National Institute is coordinating joint action Best-ReMaP, and we are targeting childhood obesity. Why? Because childhood obesity is one of the major public health concerns or priorities in the EU member states, including Slovenia. We know that obese children will very probably become also obese adults with many physical health, mental health, and other problems when they are aging, and specifically in the old age. So we have to do something while children are here with us in the environments. And those environments has changed substantially. We do have much more food offer which is not healthy, and we are not physically active enough. We know that individuals cannot choose if they don't have healthy choices in their environment as the easiest choices. So what we are doing together as a member states, we are trying to change food environment by increasing reformulation of foods available on the European markets. We will do that by proposing the policies for monitoring so that we know what's happening at the EU market. We are trying to reduce marketing foods to children, specifically in digital environment. And we are trying to increase the use and the potentials of public food procurement policies. Joint actions are very specific mechanisms where member states join forces. It means that they prioritize their health concerns at the Council in Brussels together, the Council of Ministers. And the ministers decide where they are going to put funding so that the member states can do something together. And I'm very happy and pleased that in our partnership of 24 countries and 36 partners for 3 years, we were able to do a lot in exploring what policies can be implemented, what works really if we want to make change.
Rates of overweight and obesity are unacceptably high, particularly in the case of children. Healthier diet, active lifestyle are among the factors that we should look for to tackle the obesity epidemic. Best-ReMaP sits really at the crossroad of action. It's very important we change the environment in which our children live and we live ourselves. Better reformulation of product, regulation of marketing, procurement for healthier food both in schools is the way forward. We need to continue action on this side, and the best actions that are tested by Best-ReMaP should be scaled up at a national level and transferred across countries.
Joint action brings together 17 European countries that during the last 3 years worked jointly to improve the actions at the EU and national level on restrictions of food marketing to children. During these 3 years, we worked in developing different tools. For example, we developed, with the support of the WHO, a new nutrient profile model to identify the foods that should be restricted to be marketed to children. And what I can do as a country, as Portugal, has participated in this joint action, is that it was very important because Best-ReMaP gives us guidance, new tools, and support and capacity building to improve our actions on food and nutrition policies.
My name is Karine Vin. I'm working at ADSES, the French Agency for Food, Environment and Occupational Health and Safety, and I was leading the work about food reformulation in Best-ReMaP. Our objective in this project was to implement a common methodology in order to collect, codify, and treat the data the same way in all the participating countries. For that purpose, We have collected composition data at brand level in 18 different European countries. We have gathered them all together and we have analyzed them all together. All this data will be put in a common and open European database that will be hosted by the JRC, the Joint Research Centre of the Commission, and it will allow to make comparison between countries, to establish benchmarks, to identify room for reformulation, and to improve the quality of the food offer. This action, together with the action taken about food marketing and about food procurement, will allow us to improve the food environment for the European citizen.
We are aiming at changing the food environment, especially for children. In fact, the aim of this joint action is to tackle one of the most important public health problems at the moment, that is childhood overweight and obesity. We have achieved this goal through the interaction with the stakeholder at national, European level with a multi-sectoral approach. Then we have put in touch and we have facilitated the discussion between the scientists and the policy making, and in details, Work Package 4 has the goal to ensure a long-standing sustainability and implementation of evidence-based policies both at the European and national level.
Everything we do in the field of childhood obesity is strongly based on expert evidence. The key to the success of Best-ReMaP is to properly translate the expert evidence and present it to the political decision makers, as well as provide a good argument for the proposed policy measures. Best-ReMaP has perfectly cooperated with 3 research projects: STOP, Co-Create and PIN, with which we organized several events where we concretely demonstrated the possibilities of transferring scientific research into political practice and presented it to various groups of stakeholders.
I'm Franco Sassi. I'm a professor of international health policy and economics at Imperial College London, and I've been a member of a scientific advisory board of the joint action Best-ReMaP throughout its duration. The work I've been doing has been aimed at highlighting how obesity has been a global public health challenge that has been growing by the day throughout the duration of the project. And yet governments have taken a very complacent approach to the problem, with very little action in terms of preventing the disease from occurring, and more action in terms of developing solutions that are entirely within the medical sector. Today, we cannot afford solutions that are entirely medical for this problem. Sustainability of healthcare systems has become seriously under threat, especially after the pandemic. We need to intensify our efforts to prevent the disease by addressing the social and economic determinants that are causing it, by strengthening regulation on the actions that industry puts in place, particularly the food industry puts in place, persuade people to eat foods that they don't need and they don't benefit from. And also we need to protect consumers, particularly vulnerable ones like children, from the manipulation of advertising of food that really makes them become obese at much earlier ages than it used to be.
I'm Paolo Vines. I'm professor of epidemiology at Imperial College in London. I'm here as a guest because I contribute to the last meeting of Best-ReMaP. I already participated in another big action on childhood obesity, STOP. My role was to discuss today about the interface between science and policy. So what we notice is that there is much scientific evidence about the possibility of preventing childhood obesity, but the weak link is with policymakers, and it is our belief that policy is not doing enough to transfer into action the scientific evidence. Also, I work on climate change, and there is a close connection between climate change and health and food. About 25% of greenhouse gas emissions come from the food system. We believe that if we tackle both climate change and the food system, we have several advantages that we call co-benefits, that is prevention of obesity, obesity in children, cancer, cardiovascular diseases, and also mitigation of greenhouse gas emissions.
I was brought in to assist on the Best-ReMaP project, looking particularly at health inequity. And that means inequalities between population groups to do with their socioeconomic status, their wealth, their affluence, perhaps their educational level, and to ask whether these issues can be, the health inequalities can be reduced by policies that the Best-ReMaP project is looking at. And we did a literature review looking at what other papers could say about this and what criteria you could use to judge whether policies are effective. And we drew up a checklist to show what sort of issues we need to be looked at if you're to ask how can the policy affect health inequity. So we came up with our checklist. We then applied it to the three policies that Best-ReMaP is looking at, the food procurement policies, the food reformulation policies, the marketing to children policies. And we found that by running through this checklist, we could assess that the health inequity would be reduced by all three policies. All three policies would show good results in terms of reducing the inequalities between different social classes.
Childhood obesity is one of the major public health problems, especially in families with low income. This is why we need to try to work in this children environment in order to make the healthy option the easiest ones. And in order to do that, we need to work hand by hand, public authorities, academia, private sector, in order to choose the best policy and the best action in order to implement them and to reduce obesity and the overweight in children in Spain, but also in all Europe. We can do this only working together, all member states and all the associations together.
Best-ReMaP recognized the importance of research and harmonization of measures at the local structural level and its placement in the EU structure. In order to achieve our long-term goals, it is very important to engage also young people, including researchers who are passionately dedicated to improve their generation's health challenges. We are immensely proud of their contribution and happy because their knowledge will benefit also future generations.
Hi, my name is Knut Inge Klepp, and I work with the Norwegian Institute of Public Health in Oslo, Norway. One of the things that we're really concerned about in Europe is this growing rate of childhood obesity. Childhood obesity is caused by a number of different factors, but one of them is enormous amount of marketing and advertising for unhealthy food and drinks that we see targeting children and young people. And within the Best-ReMaP project, there has been a lot of really important work to see how is it possible to regulate this marketing in a better way and make sure that children and young people rather get information and are exposed to information about healthy eating rather than unhealthy eating and drinks. So this work really contributes to see how countries, both at the national level and also at the regional and local level, can do a number of things to limit this type of marketing. And this work will be important then for the countries now in the future. And as of next year, we will in Europe start a new joint action project focusing on the prevention of non-communicable diseases, including childhood obesity. And the contribution of Best-ReMaP will be really important to what we are going to try to accomplish in the years to come.
For the past 3 years, I have been working in Best-ReMaP in the food procurement work package. I'm so happy that I did this because I believe that all the countries that participate in Best-ReMaP are trying to improve the quality of food that children eat in public places like schools. And I think that this is very, very important because some children might have even 2 meals in school. So I really hope that all the countries will do great improvement in this sector. And I think that it is very important to provide children with really high quality food.
My name is Gabriele Gruber. I'm working at the Austrian National Public Health Institute, and I was part of the Austrian Best-ReMaP team, mostly working on the work package on public procurement. And we really enjoyed being part of this huge joint action, gaining so much experience in a new field of public food procurement and learning so much about the settings in other countries. And happy to continue our work in the next joint action to prevent NCDs.
I did the data analysis to look at how the products changed over time in the nutrient content, and I think it's very important to change the food offer, and by doing the analysis you can see how the offer changed, because what is offered in the supermarket is that what people will consume in the end, and to combat foods with bad nutrients you need to change the foods. I think the work in Best-ReMaP was really effective in seeing how the food offer changed over time and see how it will in future impact the health of children.
I'm here today because I've been working in the Best-ReMaP joint action for the past year as part of the Work Package 6 team and also as a partner in some of the Work Package 5 activities. It has been a great opportunity for me to work in this project, particularly for the beginning of my professional career. It has enabled me to learn quite a lot, to network and to work with people I admire. I think the main message I would like to share today in this communication is that it is so nice and it is so uplifting to see big projects like this one involving and giving a voice to young people just like myself.
It is important to support the work in the critical field of children's health with all the key actors, including the World Health Organization as the most important public health knowledge hub for the European region member states, promoting health and safety while helping the vulnerable worldwide.
Hi, my name is Stephen Whiting. I'm a Technical Officer for Non-Communicable Diseases at the WHO Regional Office for Europe. On behalf of WHO, I'd like to thank the organisers of the Best-ReMaP conference for the invitation to be involved. We've been working closely with Best-ReMaP. One of the priorities of WHO Europe is the reduction of childhood obesity, and it aligns very closely with the work of the Best-ReMaP project. We've especially been working with the work package involved around food marketing and developing approaches to monitor digital marketing of unhealthy food products, especially to children. And we've developed now an AI tool that can be used to support countries to monitor the marketing of unhealthy food products to children and young people. So we're looking forward to continuing to collaborate with the colleagues.
Ensuring children's health requires action at the structural level. Policy and decision makers have a key role to play in creating environments that enable and encourage healthy choices. EU institutions, as key players in the European policy landscape, are supporting the results of Best-ReMaP in the scope of different strategic EU frameworks, EU4Health Programme, Together for Health EU Best in Cancer Plan and Farm to Fork strategy, to list the most important ones.
It's a great pleasure for me to be here in this Best-ReMaP final conference in Paris. As a program manager in ADEA, I had the pleasure to follow this joint action for almost 1 year now, and I must say you guys have delivered very good result with high level impact. In particular, I think it is worth mentioning what Best-ReMaP will be doing in terms of sustainability to actually transfer the results of this action into the new joint action that we have in the EU4Health program, in particular the Annual Work Programme 2022, where we will be having 2 new joint action with member states, one on the health determinants for the prevention of NCDs and including cancer, and another one on NCDs prevention with a particular focus on diabetes and cardiovascular diseases. Therefore, I believe with your project represent a tangible result on the EU added value of our projects that we manage in ADEA, making synergies actually also between the third health program and the new EU for Health program that we are currently managing in ADEA. Therefore, for me, it's a great pleasure, and I hope the result that your project is producing will be further used and scaled up in other member states joining the new joint actions I've just mentioned.
Hello, my name is Jan Wolgast. I work in the European Commission Joint Research Center, which is the in-house science service of the European Commission. And we have been focusing on health promotion and nutrition for many years, promoting healthy lifestyles, nutrition, physical activity. And we are working as collaborative partner with this joint action, Best-ReMaP. And so the topic on what joint action Best-ReMaP is working on to promote healthy nutrition and especially focusing on children, I think it's important for us as society to support, because children are a vulnerable group and they have a right to grow up in a protective environment, such as free from aggressive marketing on unhealthy products. They should be offered nutritious and healthy products. And of course, also in schools, which links to the public procurement. And the JRC is a collaborative partner, and we have been working together with the food reformulation package, building up a web-based tool where the data that is collected in this joint action and already before, and hopefully in the future, is hosted at a central place and made available to the public, to researchers and policymakers. And we also currently work a lot on public procurement. And here the objective is for the future framework for sustainable food systems. And this should help setting mandatory criteria in order to promote healthy and also sustainable nutrition in education and every public institution. We also do some more exploratory research, for example, linked to children. We have a research project that promotes the implementation and improve the acceptance of sustainable healthy eating in schools by co-designing it with the students, the menus, and also making sensory science tests so that the acceptance increases in children. Or we look, for example, in another project on the role of law that can play in protecting children's oral health, for example, where sugars and free sugars especially is a factor of risk. And I wish for the future of this joint work of the member states and the EU that in the future joint action these topics can be pursued and developed further, and we can create the evidence of what policies really make a difference in promoting healthy environments where children can strive and grow up healthily.
So my name is Samuele Tonello, and I'm a research coordinator at EuroHealthNet. We've been part of the Work Package 4, so on the sustainability and the policy implication of Best-ReMaP. The main part of my work has been on creating a food system indicators to insert in the European semester. To oversimplify, the European semester is the main mechanism to coordinate the economic and fiscal frameworks at the European Union. And it is also one of the main mechanisms to cooperation between the member states and the European institutions. Since its beginning in 2010, it has been mainly an economical instrument, but recently it has included more and more social indicators. And so especially this has been proven by the European Pillar of Social Rights. And so we wrote an advocacy paper, and we are bringing the case to recreate something similar for the food system as it was done by the European Pillar of Social Rights. So we believe that inserting a set of indicators for the whole food system, so from the production to the distribution to the consumption of food in the European semester, could help member states and European institutions to move towards a more sustainable and healthier food system.
I am Wim de Beuclaere. I work in the European Commission and the Directorate Santé, DG Santé, and the unit dealing with the Farm to Fork strategy, and in particular I'm working on the framework, on a new framework regulation for a sustainable food system. An important aspect of that work which we are doing is looking at how we can introduce and how we can increase sustainable public procurement of food which is offered in schools and public institutes. For that purpose, we were closely following the work which is done during the Best-ReMaP, the work package 7s on public food procurement, and it has been very useful for us because we have learned that there is a lot of information and a lot of information that still can be exchanged. There's a lot of knowledge that needs to be increased. We are also looking at how we can do that, how we can raise awareness, how we can share this knowledge, and we're also considering possible mandatory criteria. So we are very happy for the support and the experiences that has been exchanged during that work package, and it has helped us and it helps us a lot in drafting and introducing sustainable public procurement in our draft new framework or proposal for a new framework for a sustainable food system. Thank you very much, Best-ReMaP, for the good work that you have done.
As one of our interviewers has expressed, we should not be too mild on the urgency. We have to act. Obesity is such a massive issue that we really need to stress that we cannot afford to wait for tomorrow, and we must absolutely act as soon as possible and as strongly as possible. We need to act immediately while also being positive about how much we could achieve if we implemented what was offered by Best-ReMaP outputs. Everything we have achieved so far is just the beginning. We still have 4 years of hard work ahead of us to establish effective monitoring at the level of the European Union. Only by working together we will be able to create a healthier environment for our children in the future.